Very good afternoon and a warm welcome to one and all who have joined. I'm Dr. Sanjana Vatsa, and I am a cornea and refractive surgeon, and I'm practicing at Dr. Agarwal's Eye Hospital in Indiranagar, Bangalore. Today I'm here to just talk a little bit about the refractive procedures. So when I say refractive procedures, a lot of you would have heard about something called as LASIK. Like, if somebody is wearing glasses, they want to like get rid of their glasses, or what are the options available. So most commonly you would be knowing about LASIK procedure. So we will be talking about the different options that are available. Suppose you're thinking of getting rid of the glasses, and I will be explaining a little in detail about each of the procedures and what are the prerequisites and what do you have to look at after the procedure and what are the post-operative care. So just we will be touching briefly about all these. And after the session, then we can probably take the question and answers. Like if you have got any queries, I'll be happy to answer. So, starting with the thing, when we talk about the refractive surgery, it's a broad term that we use mainly in order to correct the refractive error. So, when I say refractive error, it can be something like myopia, or you would have heard of hyperopia, wherein sometimes a patient will be able to see something close by, but far off objects will be blurred, or some patients can see the far clear, but the near ones will be blurred. So, whatever it is, when you're wearing glasses, either it is myopia or hyperopia, it can be corrected if you're interested in getting rid of these glasses. So, majority of the time, it so happens that they're not comfortable wearing it all the time, or it can either be for some cosmetic purposes, or it can either be for some occupational purposes. Sometimes, if they want to join army, navy, or something, they have specifications. And if they are dancers, they don't want to wear glasses. So there are a lot of other indications as to why one would choose to go for a refractive surgery. So when you have decided that you want to get rid of your glasses and have a completely glass-free vision, what is the next step that you would want to do? So it is always advisable to meet your ophthalmologist and get a complete evaluation done. So when we say the complete evaluation, the first step is get your power checked. So when we check the power, we'll get to know as to how much is it, whether it is a lower power or a higher power. And we also get to know whether it is stable from the past 1 year or past 6 months. Because if the power keeps on changing, then it will not be possible to go for the surgery. So we want the stability of your power, or rather it should not change more than about zero point 0.5 or maximum 0.75 in the last 1 year. And after we check your refraction and the refractive stability, and also before that, the most important thing is the age at which a person can undergo these procedures. So usually we advise after the age of about 18 to 20 years, because by this time the refraction will be stable, and then the changes going forward will not be much. So the next thing is that when we look at the refraction, is that enough? No. We also do a couple of other tests to identify whether you are a suitable candidate. Like we do something called as a corneal scan, that is called corneal topography. This tells us the details like, what is the thickness of your cornea? What is the cornea is basically the black portion of the eye. So that is where the laser is being done. So here it tells us about the thickness of the cornea, what is the shape of the cornea, whether your eyes are suitable to go ahead with the laser procedure. And if so, there are different types of laser surgery, which would be the best option for you. Can be decided after we do the scan and after we check your power. So other than that, we also do certain other tests to see if you have got any dryness of the eyes, because in cases of severe dryness, we have to first treat them before we go ahead with the laser surgery. And then we also look at if you're a chronic contact lens wearer. Then we say that you have to be off contact lenses for about like 4 to 5 days before you go ahead with any of the scans or even the surgeries. And then we also do a detailed evaluation of the eye to look at the front part of the eye, and then we also look at the back part of the eye, which is called as the retina or the nerve, to look for the functioning of the nerve, and everything seems to be fine. Then we can go ahead with the laser surgery. And we also look at the presence of any other systemic diseases, like sometimes there can be diabetes, or there can be hypertension, or there can be thyroid or arthritis, etc. So these can also affect your power, and also can affect your surgery sometimes. So all these needs to be under control before you go ahead with the procedure. So the next thing is, once everything seems to be okay, so what are the options that I have? Now, you know that in the market there are so many options available. Commonly, you all would have heard of something called as a LASIK. Now, in LASIK, again, we have different varieties. We have something called as the microkeratome or the blade LASIK, which is a little conventional or the older type. And then we have something called as the femto LASIK, which is a little advanced version of LASIK. Then we also have got in the market now, which is quite popular, which is called the Contura LASIK. Now, again, which type of LASIK will be suitable for you? Again, depends on your power. It depends on what is your corneal thickness and what is the shape of the cornea. So, thus, it can differ from person to person, and it is not something which is broad term for everybody. Only after we do a detailed evaluation, we will know what would be the best for your eyes. Other than that, we also have something called as a very basic type of surgery, which is called as PRK. Now, in PRK, again, this is also a very safe procedure. And we limit the surgery only to people who have got lower powers. And in this procedure, it takes a little longer time for the recovery compared to the other advanced procedures. Now, other than these, we also have the one which is again extremely popular now amongst people, which is called the smile procedure or the relax smile. Now, the smile procedure is very advantageous because here the recovery is very quick and the downtime is very short. So we say that you just have to take rest for about 1 or 2 days, and after that you can do all your normal activities and you can get back to your work, etc. And this procedure is extremely safe, and also the long term stability is very good. The chances of dry eyes, etc., are much lesser compared to the other procedures, and thus it has gained the popularity these days among the public that majority of them opt for smile procedure. Now, other than that, there are some cases wherein the power is extremely high. Let's say somebody has got about minus 15 or minus 18. They will be rejected for LASIK procedures because we can do the laser or LASIK or smile only up to about minus 10 diopters. If somebody has more than that, then what would be the option? We do have something called ICL, also called as implantable contact lenses. These are excellent options, particularly for higher powers. In this, what we do is we will be just inserting a small lens into the eye, and this remains inside the eye. You cannot remove it out, and nobody can see from outside. There is no hassle. It looks like a normal eye, and the power is corrected. So there are multiple options available, starting from even zero point 0.5 power, even up to about minus 20 to 25. So which procedure would be the best for you? Again, depends on different variables like your corneal thickness, corneal shape, what is your age, and what is your power. Based on all this, we decide what is the best option for you. The next thing is the post-operative care. Is it something very tedious? Do I have to stay at home for 1 week, 1 month? No, these are all very advanced procedures. As I said, it just takes about 2 to 3 days rest, and after that, you can start your normal activities. And you're quite comfortable from day one itself. And even to look at, if somebody looks at your eye, it doesn't even seem like you have undergone any surgery. So these are highly advanced and extremely accurate, precise surgeries, and downtime is very less, and getting back to your work seems to be very quick with all this. And again, we have certain medications that we will give after the surgery, and usually these are in the form of drops, and these medications are given up to for about 1 to 1.5 to maximum 2 months. And these surgeries are almost literally painless because we apply the anesthesia drops. There is no injection, nothing given, and these anesthesia drops are going to numb your cornea within 30 seconds. So when we are doing the procedure, you hardly feel any sensations or any pain, and you're quite comfortable during the procedure. And these procedures are pretty quick, like it takes hardly about 5 minutes to maximum 10 minutes per eye. So within about 15 to 20 minutes, you're done with the surgery, and it is a walk-in, walk-out, and the same day you're discharged, you can go home, take rest, and next day you seem to be pretty fine to do all your normal activities. So this is in brief about the types of procedures that are available in the market, and also what are the prerequisites before you go ahead with the surgery. So I will be stopping my presentation here. And if you all have got any queries, I'll be more than happy to answer at this point. Yeah, so one of the questions we have got is this safe? Now again, yes, so we first look at the safety in terms of, the cornea of your eye. First we have to look at that, and that's the reason why we do these scans, like this topography scans, to see whether your thickness of cornea is good, whether the shape of the cornea is good, and for your power whether this is suitable. And we also rule out other conditions like dryness or any other problems in the eye. So once we rule out all these things, and if you're fit to go for the surgery, then definitely these are safe options to go with. And again, the safety of it depends upon the surgery to surgery. So we choose which one would be the safest option provided your power and your corneal thickness. Taking into all this consideration, yes, 99% of the times it's going to be accurate. And sometimes, very rarely, if there are some major changes in your hormones in the body, or if there is any slightly variation in the way your eye heals, then in such cases it may take a little longer time for the recovery, but otherwise it is extremely safe, and also the results are very promising and long lasting. So the another question what we have got here is, I'm 40 years old and have progressive number. Will LASIK surgery help me to get rid of both the near and far vision? Yes, so usually what happens is after the age of 40 years, we have both for distance power as well as for near. And in these cases, yes, there will be again LASIK is also available even for 40 plus years, and this can correct both distance and near as well. There is another question which says, "Is keratoconus treatable disease, and can we clarify our vision once again?" So basically, keratoconus is something which is a completely different thing. Now here we are talking about the refractive surgeries, but keratoconus is a different type of a disease which comes to the cornea, wherein the cornea is ectatic in shape. When I mean to say ectatic is that the normal shape of the cornea remains like this, but in keratoconus it's extremely curved or it is steepened. So this condition happens mostly because of a genetic problem, or it can be because of excessive rubbing of your eyes. A lot of times we say that people not to rub their eyes because it can have an impact on the shape of your cornea and can cause keratoconus. And this is something which not many people are actually aware of. Only when they go for a normal eye checkup, we will be able to pick it up, or we'll do certain scans to actually diagnose this disease. Now, suppose you have got keratoconus. Yes, definitely it has treatment. There are all advanced treatment options which are available. We do something called as a basic surgery to strengthen your cornea, and also we do certain surgeries to improve the clarity and quality of your vision. And this is something which needs to be treated at the earliest, and there is no way that this disease can be actually ignored. So, and suppose let's say the patient has got keratoconus, then we don't advise them to go for LASIK surgery. We have other options for them in the form of ICL, etc., to correct the refractive error if they are interested in getting rid of their glasses as well. Next question is, should the usage of contact lenses be avoided before LASIK? Yes, so usually even before we do the scans, we tell the patients to avoid using the contact lenses for at least about like 4 to 5 days before that. The reason being, when you're using the contact lenses, it can cause a lot of dryness on the cornea, especially for people who use contact lenses for a very long time in a day. And if they're using it from a very long time, in the sense like the duration of it has been a couple of months or years regularly, so those patients will have less oxygen going to their cornea, and there is a lot of dryness, etc., which can impact the quality of your scans. So we avoid at least about 4 5 days, and it is always better to avoid using contact lenses at least about a week before you plan your LASIK procedure. The longer it is better. If you can get even about 2 weeks time, it's always good. But minimum, we say up to 5 6 days. What is the ideal age for LASIK surgery? So as I mentioned, usually we allow the LASIK procedure after the age of about 18 to 20 years. Now, the reason being, by 18 years, majority of the times your power gets stabilized because the growing age stops. And usually, just like how the body height increases, similarly the eyeball size increases when there is a growing age. So when the eyeball size increases, the power increases. So that's why we want the growth to have been stopped. So around the age of 18 to 20 or max 21, it stops, and that is when the power also stabilizes. After which you can plan the procedure, and you can ideally, it is advisable to do it before the age of 40 years so that you can get complete independence from both distance and near. But even after the age of 40, it can be done provided rest of the parameters, everything else being normal, we can still consider. The next question is there any pain in the surgery and which process is best and what is the accuracy rate? So as I mentioned, it is almost literally painless because we apply the numbing drops, which is the topical anesthesia drops. So within 30 seconds, it starts acting and you don't feel much of the sensations. And this is almost completely painless and is quite comfortable. And which procedure is the best? Right now, the best option what we have is the relaxed smile procedure, which is a flap bladeless option. And here the chances of dry eyes are very less, and the recovery is quite quick, and the long-term safety and the stability is excellent with the relaxed smile procedure. But other procedures, what I mentioned, we also have the femto LASIK, we have the contoura LASIK and PRK, which are also good. But again, the safety depends upon your eye and your power and your corneal thickness. But overall, it is not a broad term, but all these are extremely safe provided you're suitable for these surgeries. The next question is post LASIK surgery, if patient develops cataract later on, what will be the best correct calculation for power of the eye? Yes, so cataract is something again completely different. So this happens as in like lens which is there inside your eye becomes cloudy, and because of that, you're not able to see clearly. And this is usually an age-related thing, majority of the times, and usually develops around the age of 50, or it can be after 60, or maybe even after 70 years. And once you develop the cataract surgery, yes, definitely the treatment is the removal of the cataract and putting an intraocular lens inside. And now the treatment options have been so advanced that the accuracy of calculations, everything are extremely good. So even if you have undergone any of these LASIK procedures, you can definitely undergo a cataract surgery later safely and get very good results as well. So the next question is, can I undergo LASIK if I have keratoconus? So I think I've already mentioned before, if you have keratoconus, LASIK is something which is contraindicated. We do not do that. But if you're willing to get rid of your power, even with keratoconus, there are options available. Sometimes we do what is called as a PRK, which is a basic type of laser along with the strengthening procedure. We combine both. So in that way, your power gets corrected and your cornea also becomes strong and keratoconus does not progress. But there's also other options like what is called ICL, where I mentioned, where we put a contact lens inside your eye. That can also be done to correct your power. But the normal LASIK procedure is something which we don't do in a frank keratoconus patient. Then we have another question. My eye number is minus 9 to 10 and the corneal thickness is 500. Am I eligible for LASIK? So again, 500 is a slightly thinner cornea for higher power like minus 9 to 10. So in such cases, what would be the best option would be ICL. But again, I cannot exactly tell you whether you would be suitable for ICL also because we need to do certain scans to see whether you're suitable for ICL as well. But a normal LASIK, we generally don't advise for a corneal thickness of about 500 because it's a little thinner. Okay, the next question is my age is 32 and my all family history is weak eyes. I have also minus 5 power glass and minus 2.5 cylinder. Can I go for LASIK? What chance after age of 50 LASIK will fail? So one is looking at your age, 32 years, yes, you can go ahead with the procedure. Second thing is when you say the family history with weak eyes, we do not know what exactly is the definition of weak eyes. Probably they all have higher powers, doesn't matter. Next is you have minus 5 along with minus 2.5 cylinder. Yes, even these powers can be corrected. As I mentioned, even up to minus 10 and minus 10 spherical power and minus 5 cylindrical power, we can do LASIK procedure or smile procedure, provided you have a good corneal thickness and provided your corneal shape, etc. is normal. And what chance after the age of 50 LASIK will fail? It's not that LASIK is going to fail after a certain age. In the sense, initially when everything is safe, as I mentioned, majority of the times there should not be any problem and it's going to be stable. After 50 years, you may develop cataract or something that again affects your vision. That is completely different. That needs to be dealt in a different way. But otherwise, majority of the times, you should be good even after the age of 50 years with LASIK procedure when it's done right. So next question is, if someone have LASIK surgery before, then he again probably the mean is, can they go for LASIK surgery again? And is there any chance for the failure? So what happens is, when I mentioned that, majority of the times the power does not come back and is very safe, but a very small percentage of people can get back the power. That probably can be because of a lot of hormonal variations in the body, especially in cases of females. If they're during the pregnancy or during lactation, there is a lot of hormonal variations in them. And this can affect the vision, or this can affect the power as well. So because of this, they may get back some power. But again, if the hormonal changes settle down, the power can also go down. But sometimes it can remain as well. These are quite rare, but rare possibilities are there. And second time surgery is also possible, provided your corneal thickness is again good enough and you're safe to go for the second time procedure. Okay, so the next question is, what is the minimum power for LASIK surgery? So we can do it as low as even zero point 0.5. And next question is, my left hand side eye vision is 6 by 6, but right hand side vision is 6 by 12. Will it recover from LASIK surgery? Now, again, we need to evaluate completely as to why it is 6 by 12 in the other eye. So 6 by 6 is called 20/20 vision, which is considered as 100% vision. 6 by 12 is something where you have about 90%. Now, why is it 6 by 12? Is it because there is some other problem in the eye? Or is it just that your power was quite high in that eye, because of which the eye became lazy, because of which you have 6 by 12? So there are multiple reasons. Without evaluating, it will be difficult to say. But if it is 6 by 12, even with the best possible correction, then with LASIK, it's not going to become 6/6. It is still going to be 6/12, as in you will be getting the same kind of vision what you're getting without, so whatever vision you have with the glass, the same vision you're going to get without the glass. So the next question is 40 years old male eligible if he is having minor cataract or needs to wait in case if possible? See, again, the cataract depends. It can be different types of cataracts. So there are some people who have cataract right from birth or when they're growing, which are called as congenital cataracts, or they can be developmental cataracts. These developmental cataracts are something which don't affect the vision. They're just tiny dots which you can see in the lens, and they kind of remain stationary and do not cause any problem. And if you have that kind of a cataract, then definitely you can go ahead with the laser surgery. There is no problem. But there is another type of cataract which is called as an age-related cataract, where once you age, you develop that. That is something which progresses with age. So if you have a age-related cataract, then it is definitely not advisable to go for LASIK. It is better to do the cataract surgery, and that itself is going to correct your power as well. So the next question is, nowadays it is very difficult to take away the TV and mobile phones from our children, and how can we take care of children's eyes? This is something which is totally off the topic. However, I would say that yes, it is difficult to completely restrict them, but it's very important to educate them as to, it is not a good thing to see regularly. Even if they want to see, they can see only for about like maximum half an hour, and they need to take breaks in between. They should not keep it very close to their eye. It should be at a comfortably far distance. And also get the eyes checked regularly, because post COVID we do see that there are a lot of kids who are suddenly coming up with a lot of power, and they are wearing thick glasses. This is because of excessive use of computers and exposure to all these during the COVID times, that suddenly they have developed refractive errors and they need glasses. So get them checked. The first checkup at least should be done by the age of 4 to 5 years, where we pick up how their eyes are, and keep getting checked regularly every year, because the children may not say that I don't have difficulty. I mean, they do not mention that they have difficulty seeing, but only when we do a regular checkup we will be able to pick it up. So restrict their usage. We cannot completely stop it, but also get a regular evaluation to keep a check on their eyes. The next question is, who's eligible for laser treatment, and what would be the side effect, and how long retains the normal power post surgery? So who is eligible for the laser treatment? I have already mentioned that who is above the age of 18 years and whose corneal thickness is good and the shape of cornea is good after we do the scan. And if their power is in that range where it can be corrected, then definitely they can go for the laser surgery. And what would be the side effects? Again, if you have chosen the right kind of procedure, ideally the side effects are very, very minimal. Only in the initial healing time during the first couple of weeks, you may feel slight dryness. There may be sometimes transient blurring of vision, burning sensation, which is not too severe. However, we do give some drops, etc., which is going to take care of all that. And within about like 3 to 4 weeks, you're going to be quite comfortable. And again, how long it will retain the normal power? Yes, ideally, majority of the times once it's being done, the power should not come back until and unless there is a lot of variations in terms of your hormones or some abnormal healing, or if there is an injury to your eye or something, then there can be some chances that it can affect your vision. So the next question is, my eye number is -9 and -10. Should I go for LASIK? Again, yes, even up to -10, we can do LASIK. And definitely for a person who has got -10 power, it will be quite difficult to visualize without the glasses. So you will be completely dependent on the glasses most of the time. So it is always advisable to get rid of it so that you know you're quite comfortable without any glasses. And again, whether you will be suitable for LASIK or any other procedure like ICL depends on a lot of other factors like your corneal thickness and shape. But if the thickness is good, definitely even for -10, we can do LASIK procedure. The next question is Contura vision painful and what to expect after the surgery and what are the, sorry, I just lost it, 1 second. Yeah. Yeah, is Contura vision painful and what to expect after surgery? What are the precondition for this surgery? Contura is not painful. It, as I said, all the laser procedures are quite painless because we do it under the anesthesia drops. What to expect after surgery? Next day, you're quite comfortable. Maybe on the day of surgery, there will be slight discomfort or slight blurring of vision. But by the next day, you're quite comfortable. Your eyes look completely normal. Nobody can even make out that you have actually undergone any procedure. And also, there will be certain medications that you need to use and take rest for about 2 to 3 days, and after that, get back to your normal work. And the other question is, I feel always that there is some thick liquid in my eyes. Why and what is the cure or precautions? So again, it can be many things. Either it can be because of dryness or it can be some discharge from your eye. It can either be allergies or it can be infections or it can be dryness or your eyes are tired. There are multiple things. Definitely a complete evaluation is extremely important. And once we evaluate, we'll know what is the cause of it. And of course, there are multiple options for treatment in the form of lubricating eye drops if you have got severe dryness, or you can put them on anti-allergic drops if you have got allergy. So we need to identify what it is and then give the medications accordingly. And what precautions? So one thing to be mentioned here is, since most of the people now are always in front of the computers, it is extremely common that we see that there are a lot of dry eye cases. You know, like they are exposed to the system and they hardly blink their eyes and the eyes get extremely dry. And this causes, you know, the burning sensation, blurring of vision, and a lot of other problems. So everyone who's using computers, always make sure that you take frequent breaks. We do mention something called 20-20-20 rule, where for every 20 minutes, you take a break of about 20 seconds and look at something far off, which is about 20 feet away. So by doing this, you will be giving enough time for your eyes to recover. There is a rest given to the eye and is not constantly looking at the computer screen. And by doing this, there is good lubrication that's happening to your eyes and also relaxation of muscles. And in this way, you can take care of your eyes and maintain the health of it, and also can prevent the problem of dryness and computer vision syndrome and other problems. Next question is, what are the complications and probability of occurrence of myopia in the future? So the complications, see, when the surgery, we have chosen the right one, which is suitable for your eye. And during the surgery, if all the precautions are being taken and if you're cooperative for about just 5 minutes during the procedure, the complication rates are almost nil. And what is the probability of occurrence of myopia in the future? As I said again, majority of the times it's not supposed to come back if a safe option is being chosen. And again, very small percentage because of some hormone changes. We cannot exactly predict it before, but yes, majority of the times it's safe. That is why do a complete evaluation first and then get all the options and understand about each option and talk to your ophthalmologist and understand for your profession, for your needs and for your power and your corneal thickness, what would be the best option, and then go for the right kind of treatment. So by doing this, yes, majority of them are safe and they're happy to get a glass free vision. And this is something that everybody can think of if you all are looking for it. In general, what is the percentage of failure? Very, very, very minimal. And I think pretty much we have answered most of the basic questions. And obviously, if you want a detailed evaluation, you can always get it checked and then go for the right kind of treatment for your eyes. So I think we are done for today. We're running short of time, and I'll be probably ending my talk here. And I thank you all for joining. And